Introduction. All right, let's welcome everyone to the May Healthcare Task Force of the Colorado League of Women Voters. We've got Dr. Laird Kagan here to talk to us about the privatization of Medicare, which is, I know, a fraught and personal issue for many of us who are over 65. For the past 20 years, Dr. Kagan has been interested in the politics of healthcare and the availability and affordability of healthcare for all citizens. In this regard, he's been president of the Boulder Valley Medical Society twice, a board member of the Colorado Medical Society, and the long-term medical director of the Boulder Valley Independent Practice Association. And he is also here with us as a speaker from PNHP, which is Physicians for a National Health Program. Did I get that right? I always have to think about, the initials. But let's welcome Laird and go ahead. Anytime you're ready, Laird.
Thank you, Thalia, and thank you for inviting me to speak tonight. I'm going to start off with a very brief story. My wife and I went to southern Utah last week to
Mm,
see all the national parks. We visited 5 parks and then one wildlife reserve. I think it's called Escalante. And
mm,
it's so beautiful. But the reason we went is I was afraid that they're all going to be sold off and uh,
mm,
used for oil exploration.
mhm,
This might be a little bit, that might be a little bit paranoid of an idea, but what I'm going to talk about, especially Medicare Advantage, is not paranoid. I have bad news for you all uh, about Medicare Advantage. Um, it might make you sad if, for the things you haven't heard about yet. It might make you cry. And it did
mhm,
bring me near tears when I was working on preparing this talk.
mm, mm,
So,
mm,
first, I want to mention that the word healthcare, it's really 2 words. And the word health makes you think that healthcare should be something to improve the health of the population and to make sure everybody's health is as good as possible. And the word care to me means that we should be caring for everyone in our society in terms of their health and giving them good empathic care.
mm.
So in no way does this mean that private profit should have anything to do with healthcare because it corrupts any attempts at having a good healthcare system. And unfortunately, that's where we are now. So I'm going to talk about mostly about Medicare Advantage, and then probably be some time to talk about the cuts to Medicaid, which obviously have just come up today in particular. And then I'll talk about the US healthcare system in general. So the first slide, Beth. Okay, so actually, I think the second slide. And these slides, they seem to have a life of their own.
That's okay.
So I'll start off with Medicare was started in 1965 by Lyndon Johnson, and it was designed to provide good health care for Medicare for seniors, health care that was affordable and without barriers, easily accessed. And it's worked obviously well. I love having Medicare. Um, in in 2008, I believe, Medicare Advantage was added, and Medicare Advantage is a program where the government pays these private insurance companies, for-profit insurance companies, for each person they have contracted with for health care. And then the insurance company then arranges to pay the bills for the patients, and they keep all the rest of the loot that's left over. And the idea of Medicare Advantage was that it would improve even the good aspects of Medicare. But unfortunately, as we'll see, Medicare Advantage is a big step back. And it's because it's a profit-making plan as opposed to Medicare, which is not so. So next slide, please.
Beth,
Beth, I don't heard me. Next slide.
where'd she go? Uh-oh.
Sorry, I lost my audio for a minute.
Oh, there we go. Can you get the next slide going?
Working on it.
Okay. Okay, good. Just making sure since I can't see you.
I'm sorry, folks.
That's okay. Laird, while we're waiting, I do have a question.
Okay.
So Medicare was started in 1965.
Right.
Was it, it's my understanding that there was discussion at the time that we would start with 65 and older and then bring more people in, like 60 and up or 55 and up over time? Or was that merely a conversation in Congress or something?
Yeah, I don't know. I doubt that it would have passed back in 65 if people knew that it was going to be expanded like that.
Mm-hmm.
So I think it's been more of the last few years where people are talking about lowering the age.
Mm-hmm.
And of course, those of us who believe in single payer would like to have it cover everyone.
That's correct. Yeah.
So maybe I should just look at my slides and
Yeah. Why don't you keep going and Beth will catch up maybe?
okay, so the only thing is I don't want to go off this screen, but I guess it won't matter, will it? If I'm looking at my
I'm
slides.
terribly sorry, having
That's okay.
odd
Maybe-
difficulties.
Maybe the slides could be sent with the, with the chat or something.
They could be.
Absolutely.
Mm-hmm.
So it looks like I can look at, I can stay on a small screen and then also look at my
Okay.
slides
Yeah.
on the other half of the screen.
Okay, we did it. Oh,
Timothy?
okay, here we go.
Oh, you got it?
Yeah.
All right. I'll turn this off then.
Somebody had it.
Do you see a slide?
I do see, what number slide is this?
That's difficult to say.
It was only, at first it had a whole bunch of information on it and then just the header and nothing else.
Well,
Well,
I'm going to look at my slides and just talk. I think that's going to be the best thing.
Okay, and if Beth can figure it out in the meantime, yeah.
Okay,
Go ahead, Laird. What the heck?
All right. Well, I'm just opening up my slides now.
Okay.
Sorry for all these delays.
and
Okay.
no.
The next slide. Actually, I'll back up for a moment. I'm going to talk in terms of Medicare Advantage. I'm going to talk about the overpayments and the huge amount of money that the Medicare Advantage insurance programs get. I'm then going to talk about harms that Medicare Advantage causes, and then about deceitful marketing that they do, and then finally about how people from minority groups and poor people get lesser care than other groups. And of course, this is pretty typical of U.S. healthcare system in general. So this particular slide shows that Medicare Advantage is extremely expensive. And you can see in 2023, which is the last bar graph, that about $85 billion was spent in, I think this was 2022. $85 billion of extra payments were paid to these healthcare companies by the federal government.
Wow.
This slide shows that there are actually two aspects to this, and there are a few more as well, but the red part of the bar talks about favorable selection. That means that Medicare Advantage companies attempt to encourage seniors who are healthy and won't have much in the way of healthcare costs. They want them to join, and then they discourage other people. And then the green bar, the coding intensity overpay, what that means is that even though they select the healthy people, they list every diagnosis they've had since they started under Medicare. And a lot of those diagnoses are not relevant. So for example, a person may have had a hip fracture 5 years ago and now have no disability from it. Or a person might have had a kidney injury and they've completely recovered from that. But they submit those diagnoses and the government pays for those as well, so they get additional monies from the government. Next slide, please.
I'm very
So-
sorry, Laird. I'm doing my best here, but
That's all
these,
right. So can you see what I have up now? Probably not, huh?
no.
All right, well, I'm just going to go on and keep talking. The next slide I have shows the bad boy techniques that Medicare Advantage and companies use. And these techniques are used to get more money from the federal government, like I was talking about. So the first one on the list here is upcoding. And I've just talked about that, how they add all the diagnoses. And then there's favorable selection, which we just talked about as well. A large amount of the overpayments come from bonuses that surprisingly these companies get from the federal government. There are bonuses if it's believed that the Medicare Advantage program has reduced barriers to care. And as you'll see, they actually increase barriers to care, but they still get the bonuses. And there are bonuses for providing quality care, which often is not the case either, but they still get the bonuses anyway. So the slide that I have shows that about $130 billion of overpayments came to Medicare Advantage programs in 2022. I know the other slide said some 85 billion, but I guess this all depends on what techniques you're using to determine the overpayments. The next slide, it's called The Business of Medicare Advantage, and it discusses similar things, but in a less friendly way towards Medicare Advantage. So there have been a number of fraud cases against Medicare Advantage companies, and they generally settle with fines. And unfortunately, the fines are small pennies compared to the profits that the Advantage companies are making. Another technique they use, besides committing fraud and basically getting away with it, is called cherry picking, which means, again, that they're choosing the healthiest people. There's lemon dropping, which means that if a person joins Medicare Advantage and they have high expenses, Medicare Advantage will do things to discourage them from staying with it in the next year. So they will delay care, they will not pay for a lot of care, and people get frustrated and they don't want to stay with Medicare Advantage if they're lemon dropped. And then there's upcoding, which we've discussed already. So the next slide shows some harms from Medicare Advantage. So I've moved from overpayment to harms. The death rates are double after some cancer surgeries for Medicare Advantage as opposed to standard Medicare. Medicare Advantage prides itself or claims to pride itself that they provide health care at a lower rate and people have much lower out-of-pocket expenses. But in fact, 7 million people are underinsured, meaning they can barely afford to pay for copays for yearly deductibles, and Medicare Advantage also sometimes just won't pay for certain procedures that standard Medicare would, and people have to pay totally out of pocket for whatever that procedure is. Another thing they do is so-called narrow networks, meaning that in a person's neighborhood, there may only be a few doctors that they can go see. Otherwise, they have to pay a very large amount of extra money to see somebody out of network. And this also makes it hard for them to see specialists. And then in terms of physician offices, Medicare Advantage programs have very large bureaucratic structures, partly in order to create the barriers to care that make it hard for people to get care so that they don't have to pay for it. And this wastes a lot of time of doctors' offices. And I'm sure most of you have heard of prior authorization. That is a huge barrier. Doctors' offices have to get authorization, and sometimes it's very hard to get it through Medicare Advantage. So the next slide shows bar graphs about delays in treatment. And this also has to do with cancer patients and compares delay in treatment from the diagnosis for Medicare Advantage versus traditional Medicare. And all the types of cancers, colon, esophagus, stomach, liver, and pancreas, they all have a greater delay of care in Medicare Advantage. And the pancreas cancer is particularly illustrative because the delay in care is twice as much for treatment of pancreas cancer. And there's a reason for this. It's hard to diagnose and it's hard to treat pancreas cancer. So Medicare Advantage wants to delay treatment. And then if there is treatment, we'll talk about in a minute how they put barriers in treatment too. So to me, this is pretty disgusting, but that's the way it is. Now, the next slide I'm going to talk about shows some of these barriers to care that Medicare Advantage places. We've talked about prior authorization and narrow networks. I've touched on the fact that Medicare Advantage restricts care, makes it hard to get appropriate care at times, and delays care. And then there's two other little boxes on this slide that use the words financialization and corporatization. To me, that means that the Medicare Advantage programs are interested in profit and nothing else. So another problem that we see with Medicare Advantage in this next slide is that patients with cancer get best care at a recognized cancer center, usually a research center, and usually it's attached to a medical school. But what we see is that way more patients who have standard Medicare get referred to these cancer centers, whereas patients with Medicare Advantage don't. So the difference is somewhere between 10% for Medicare Advantage and about 40% being referred to cancer centers who have traditional Medicare. And I've already mentioned this next slide just mentions again about higher death rates after surgery for Medicare Advantage patients. Now I'm going to turn to deceptive marketing practices. So we've talked about how Medicare Advantage encourages healthy seniors to join. In addition, they promise lower costs out of pocket. They promise good quality care, and they promise easy access to care. And I've already touched on and talked about to some degree is that a lot of these things are not reality for Medicare Advantage. So They are deceptive, and in terms of the barriers that they put up to care, I like to think of them as more of a barrier care company rather than a healthcare company. Another thing that Medicare Advantage does, they pay brokers twice as much for enrolling somebody in Medicare Advantage as compared to, say, a Medigap program for somebody who has traditional Medicare. And when it's time for renewal, the same thing. They pay the broker almost twice as much if they get somebody to renew with their Medicare Advantage. The next slide is a slide that is very scary to me, and it shows that if Medicare Advantage became the predominant insurance program for Medicare, that within 8 years, within 8 years, the Medicare Trust Fund would be out of money. And some people say that the 2025 project says, and I haven't seen this myself, but that it says that they want to get rid of Medicare and replace it with a much cheaper insurance program, for-profit program, and with much less benefits than seniors get now. So that to me is another disgusting thing. Now, finally, I'm going to talk about inequities in care, finally, in terms of Medicare Advantage. And this next slide shows that Black and Hispanic people have a greater percentage of them have cost-related problems and problems in paying for their Medicare bills if they are in Medicare Advantage versus white people and versus as compared to, I should say, traditional Medicare. So it's in a range of 30% have cost-related problems in Advantage, and maybe 20% or even less have problems in traditional Medicare. And the next slide that I have shows the same thing, but in terms of income. So higher income people have a very low rate of cost problems, and medium income and lower income have a much higher rate. So this alone, cost is a big barrier to care for a lot of people. Another thing I want to mention is that Medicare Advantage claims that they provide dental care, and they do have dental programs that people can have, but despite that, because of copays and some of the dental procedures not being covered, Medicare Advantage people, 30% of them don't get dental care because of cost, whereas it's only 24% for traditional Medicare patients. So I've outlined quite a number of deceitful things, including poor care, more expensive care, barriers to care. And because Medicare Advantage was supposed to make these things better, but they're really making them worse, they are cheating us. And so I say that Medicare Advantage is also in the deception business as well as in the healthcare, but not in the healthcare business. A few more things about Medicare Advantage. The overhead for traditional Medicare is 2%, and the overhead for all of the major Medicare Advantage insurance companies is upwards of 16%. And again, that's because they keep their profits and they consider that part of overhead, and they have extensive bureaucracies in order to provide barriers against patients getting care. Another point, Medicare Advantage makes about $1,700 per patient, whereas individual insurance and group insurance in the under 65 groups they have a much lower percentage, the much lower income. So it's about $700 versus $1,700 profit in Medicare Advantage. And the next slide I have, again, alludes to the fact that there's about $100 billion or maybe more in overpayments to the Medicare Advantage programs. And this money, these overpayments could be used to make standard Medicare better, or maybe to even reduce the US deficit. But the way it is now, we're throwing that money away on Medicare Advantage. So I was wondering about this. Maybe we should call Doge in to see if they could fix this problem, the problem of Medicare Advantage. So then the four biggest health plans that have Medicare Advantage are United Healthcare, Humana, CVS, and Blue Cross Blue Shield. And together they make up about 3/4 of the Medicare Advantage plans. Finally, I do want to mention one bit of hope, and that is that in 2024, Physicians for a National Health Program and other physician groups work together to advocate against these overpayments. And so for 2025, the government's paying $22 billion less to the Medicare Advantage programs than they would have otherwise. Not surprisingly, the investment community did not like this. So at this point, I'll stop and see if there's some questions about Medicare Advantage. And then whatever time we have left, we can go over Medicaid and the US healthcare system.
Wow, thanks, Laird. Sorry about the slide deck. Maybe it was just too complicated with all those drop-in bits, but we will definitely
I was struggling. I really apologize.
It was fun to watch.
Well,
to
I
see.
won't hold it against you guys.
Yeah, right. But we'll get the slide deck to everybody because there's a lot of information on each slide. And does anybody have any hands up at the moment or questions?
I can't find my hand up.
Okay, just start talking.
Okay. I'm on Medicare Advantage. And my experience is not quite the same as what you're portraying. And I'm wondering if it's because of the particular provider
Mm.
and how much difference that makes. And I'm also wondering what specifically is your recommendation?
So Tony, you have a much better experience. Is that what you're suggesting?
Absolutely.
Mhm.
I don't know anything about the financing. So
Right.
maybe something that is not done well. But as far as a patient, I have been more than pleased.
Well, I'm glad to hear that. Although I would like a slice of that $100 billion that they get extra every year.
That's for
But
sure.
it's a good question, and it's a complicated system. So some people are lucky. It depends on where they live. People who are higher income and smarter, they tend to have the opportunity to manipulate the Medicare Advantage system more easily than some of the poorer people, which the system was supposed to help originally. It also depends on what county you're in, depends on how big your network is. And I think it was Thalia who just said that it also depends on your physician.
Mhm.
So you haven't noticed any delays in care, barriers to getting care, anything like that?
Yeah, okay. Not really. In fact, they got me in the next day when I called them. For one thing, I mean, I've had several surgeries. No, but I don't have a feeling that somebody's trying to push me out of the system.
Well, I'm glad to hear that. That's
You're in the Denver area, Tony?
In Denver, I'm retired. I'm not a high income person, sort of moderate. So I mean, the experience in the list that you had there were for-profit insurance providers. if I'm saying that correctly.
Yeah.
I'm with a nonprofit.
What do you mean?
Kaiser is a nonprofit.
Oh, you're with Kaiser. And
That's a
but
whole-
you're still part of Medicare Advantage?
Yes.
Well, maybe that's a good, if you're gonna do Medicare Advantage, maybe that's a good place to go. I don't know about that. I didn't even know Kaiser had a Medicare Advantage plan.
Yeah.
But that's good. And as I mentioned, Kaiser is a small player in the Medicare Advantage field. And so perhaps if you had had one of these other companies, you wouldn't be so happy with them.
Yeah, and that was my question also, something that it seemed to me that all those guys were for-profit entities.
Oh, yeah, they're definitely for profit.
And so is the experience a lot different with them than with a nonprofit provider?
Karen, you're next, and then Les, and then Virginia.
The question that I would ask, our local league did a Medicare Advantage presentation for our community last year and had a really good turnout. Unfortunately, the majority of the people that came were people that were already on Medicare Advantage. What kind of a compelling argument? I mean, I listened to what Tony has to say, and she's obviously had apparently a really good experience. We have people here in our community that are retired educators that are getting their health insurance, Medicare Advantage through PERA, which is the public retirement program, and they seem to be fairly happy because the rates are lower than supplemental premiums are. What kind of compelling argument can we make to get people to really carefully look at what this means, as opposed to just looking at what the premium is and what they think the benefits might be? Because as you have said, once they've made the decision, they may be stuck.
Right. So I'm really not familiar with the Para Association with Medicare Advantage. And maybe like with Kaiser, they do a good job, but I can't really speak to it. So really what these two questions illustrate to me is how variable it is and how when there's less of a for-profit motive, the plan maybe works really well.
Right, but wasn't the point of the creating Medicare Advantage was because the free market was gonna, make everything better, but it's profit-based primarily. And in my mind, I agree with you, Laird, in that when you put money in the equation between the provider and the patient always loses. So I like that Kaiser is nonprofit, but I think that's an anomaly. Les, you are up next.
Yeah, I'm a retired geriatric doc. I'm also a PNHP advocate. And one of the things, and I'm actually in Kaiser, and I felt guilty because when it was time to re-enroll, I have a few diagnoses that increased my supplemental traditional Medicare. And that wasn't the reason I stuck with Kaiser. I stuck with Kaiser because I realized that they have a much lower denial rate. And I'm not sure how you get those numbers, but it is possible. That should be publicized because Kaiser has a much lower denial rate, and therefore the service is much better. The other thing is, I think there are probably more for-profit private equity firms that own the companies that are showing Medicare Advantage. And the last thing I'll mention is that when there's stockholders involved, supposedly stockholders can sue the CEO if they're not making enough money. There's a pressure there from people who are just, nice folks like you or me, mostly white, that have stocks, and healthcare stocks are a great profit. So it's so embedded in our system anyhow, I think if we could figure out if they published the denial rates and who owns what in these plans and how long it takes to get an appointment, and anyhow, I think it's and the other last thing I'll mention is if you are healthy and you got longevity in your family and you got a lower um, rate to premium and it looks good and you don't need to see the doctor except once a year, then it turns out even in a United Healthcare plan, you may be pretty satisfied. However, if you have a serious problem uh, that could drain the swamp, your own swamp, you're in trouble. So my simple-minded advice is if you're totally healthy, traditional Medicare is nice. It's more convenient. It's less administrative costs. That's another huge thing. We got to think about our trust fund, which is, literally, they all want to anyway. But the last thing is if you've got a cancer diagnosis, you do not want to be in Medicare Advantage because that's really the glaring thing that studies have shown. You get much worse outcomes if you've got a complicated GI cancer. So
You could
yeah.
be healthy on the day you pick your plan and you could get a cancer diagnosis the very next day. So it's a crapshoot as far as that kind of logic goes.
And then,
Um,
I'm sorry, Thalia, go ahead.
no, you go ahead.
Well,
And
I
then
was just gonna say, if Medicare Advantage is making $1,700 per person per year, some of that is administrative costs, but most of it is profit. It's hugely lucrative, as Les just alluded to, how much money they're making.
Yeah. Virginia?
Yes, I need to unmute.
There we go.
Thank you, Thalia, and thanks for all those great points, Les and Laird. You've done a good job talking about these things. One thing that you haven't mentioned too much is that the folks in rural areas do not have the same experience as folks like, for instance, on the Front Range. In fact, many hospitals in rural areas and in the cities are refusing to take Medicare Advantage anymore because they simply don't pay their bills. They don't get payments for care that's already been given. I mean, it's bad enough with the prior authorizations, but then the Medicare Advantage plans don't pay all of the bills that the hospitals incur caring for their patients. And I read about this first a couple, 3 years ago. It really became, kind of big news in this area. And I happened to be in San Diego visiting my son, and I, watched the local news. And they had a story about Scripps Hospital there, which is, a humongous hospital in San Diego, was refusing to, they announced that they weren't going to take the Medicare Advantage plan that, tens of thousands of people in that area had, because the Medicare Advantage plan owed them $73 million. They just weren't paying their bills. And so that's a big city. And I know that the hospital in Alamosa stopped taking Medicare Advantage. And I remember this is one of the things that kind of turned Senator Bennett around, is that, they reached out to him and they were just having horrible trouble, not getting paid by Medicare Advantage and refused to take it anymore. And then another story that really was in the national news is that the tiny little town where I went to college in South Dakota, Brookings, South Dakota, has a population of about 24,000 people. They have a municipal hospital still there. And the administrator there said that they had to stop taking Medicare Advantage there because they don't pay their bills. So I think it is the luck of the draw in terms of where you are. And I've heard from other folks who are on Kaiser here on the Front Range that they're happy with, the services they get and so forth. So I think it's a real luck of the draw as to your location.
Mhm.
Yeah, I think you're right, Virginia, and it's almost like either the Medicare Advantage programs learned from Trump or Trump learned from them in terms of not paying their bills.
Yeah, they're both pros at it. That's a good question. Which came first, chicken or the egg?
Oh, man. Oh, gosh. Yeah. In the chat, Kathy says that she previously had Kaiser Medicare Advantage when living on the Front Range and had a good experience. She's now with Humana Advantage and has become displeased with restrictions on which providers and the lower quality of providers for some care, such as hearing care. Which again, I bet that's location specific. And I know, I think might have been, I was talking with Elaine, this would have been last year. I don't know if she's still on this call or not, but she was concerned about, the limited, like in a rural area, you just have one Medicare Advantage plan and that's it. And if cost is an issue for you, you might go with the Medicare Advantage plan, but then you're really stuck in a rural area. Elaine, was that you that I had this conversation with in the past? You're on mute.
I
There you
don't
go.
know if it was me in particular,
Okay.
but it is a problem for rural folks.
Mhm.
There just aren't enough providers, first off. And
Yeah, that's true too. I mean, and back in the day when my husband first started his practice, like 45 years ago, there were a lot of providers that wouldn't even take Medicare, like just because they paid far less than private insurers, Anthem or whatever. But that's completely changed around now, and I think Medicare, standard Medicare has become a pretty decent benchmark as far as reimbursement rates go.
And I'll slip in a comment about single payer for everyone, and that is that it depends on the finances, but if it ever happens, it'll probably be paying significantly more than Medicare rates.
Mm-hmm. And save the federal government a ton of money.
Save the federal government, that $100 billion a year, that adds up, just Medicare Advantage.
Geez. So Laird, do you know anything about whether there's any congressional oversight? Like, who's responsible for reining in these profit-oriented plans?
Well, I don't know for sure, but I would guess it's one of these agencies within the Health and Human Services.
Mm-hmm. Oh, that's
Did you
terrific.
know that?
Yeah, I
That
think the agency was the Medicare um, uh, program accessory committee that figured out the huge profits that the Medicare Advantage was getting. It's MPAC is the acronym, and
oh,
they were
okay.
that they're like the congressional, the Office of Management, and
Mm,
Trump canceled the I think a lot of the oversight by getting rid of the
mhm,
investigators. And it's
mhm,
just so now it's already the rate at which they can bill has gone up. There was a 2% rate that was held for several years under Biden, and now just this spring it was raised to 5.5% increase per year, which sounds
hmm,
like a small number, but when like Laird said, when you've got millions of patients, it
mhm.
really is. It's incredible how the politics determines a lot of the profit that these people are making.
That's right. Virginia?
Yeah, I would have a comment on that. I think it's CMS overall that is kind of watching all of this. And it's basically been captured by the industry. The people roll in and out of, working for health insurance companies, and then they work for the agencies. And I will say that in the first Trump administration, when they rolled out that ACO REACH thing, I
Can you
want
put-
to I want to say that was the brainchild of a buddy of Jared Kushner's,
Oh, true.
who was brought into that agency to dream this up. And, he owned some kind of healthcare related billing company or something like that. And so the corruption is just rampant. I mean, it's just, it's not just in healthcare, but it's throughout the federal government. First, you get the dark money that goes into the campaigns and buys all of the offices, in Congress and the president. But then you've got the regulatory capture by industry in all these agencies. And, it's not just in healthcare. But I think that's where all these brilliant ideas come from. And their goal, Laird mentioned Project 2025, and their goal is just to privatize
Every-
Medicare, Social Security too, for that matter. And, if you think about, traditional Medicare is Medicare, what we think of, and Medicare Advantage is not Medicare. It's just another insurance company doing the same thing that all the other insurance companies do.
Absolutely.
It seems like I read just recently, and maybe somebody else saw it too, where there has been a push to not allow private insurance companies to any longer say Medicare Advantage. They couldn't use Medicare in their promotion. Did anybody else see that?
I've heard that in past sessions of Congress that they tried to pass legislation like that. But of course, it hasn't worked. And maybe it's one of those things that they introduce every year, but I just heard about it a few years ago and it didn't go anywhere.
Certainly not going to happen now.
Right.
Absolutely true. Yeah.
So what hope do you have for us, Laird? Do you have any?
Send us home on a good note.
Well, I mentioned about advocacy. How much time do we have left?
7 minutes.
Okay, so I mentioned first of all about advocacy that helped to save 22 billion for this year, 2025. In the overall U.S. healthcare system, the hope in my mind is that we go to a single payer and get rid of all profit motivated insurance programs or healthcare programs. I would say, I said this already, but I'll say it again. If we got to get Doge in there, and if they can't do it, maybe single payer can. I think that's the only hope we have. And I mentioned about the briefly about the Medicaid cuts, which came to the day. $800 billion or so over 10 years in cuts, eliminating 10 to 20 million Americans from the Medicaid rolls. In Colorado, it would be, I think, about 1 billion a year, or maybe a little bit more than that, and eliminating 200,000 Coloradans. And in Gunnison County, spent $1.7 billion for healthcare through Medicaid last year, and about half of that was paid for through the feds. So a lot of people are going to lose Medicaid in Gunnison County. They're going to be people that are our friends and relatives and colleagues. It's going to be really sad. And another thing that's been touched on is the hospitals. A lot of the rural hospitals are close to closing already, and they're just not getting enough income. And with the reduction in federal payments to hospitals through Medicaid, they're going to definitely go belly up. And then I hope that for Gunnison Valley Hospital, I understand they're doing pretty well financially, and I hope that they stay. They're an important part of the county.
Mhm.
So,
But most rural hospitals, run on a 1 to 3% margin, and Medicaid cuts could just demolish them.
right.
Yeah, Virginia?
I would say while all of these horrible things are true and may come to pass, you know, people are literally just going to be dying. Tens of thousands of people every year will be dying because of these cuts. And it's just horrible. And, but one bright spot is here in Colorado, we did pass SB 45, healthcare payment system analysis. It'll take a year or so to get that thing done. And, if all of these horrible things come to pass, people are just going to be desperate for alternatives and answer. And if that analysis shows that, well, yeah, we maybe could save up to billions of dollars a year and cover everybody here in Colorado. And so, let's try it because things are so horrible that we have to do something else. So this horrible, horrible turn of events and crisis could be a turning point.
That's a good point, Virginia. Yeah.
I just have to remain hopeful, because it just can't go on this way. It's just horrible.
One caveat of Virginia is that we've got to raise $750,000 to.
Right, to pay for the study.
We'll get her done. Don't worry. Don't worry, Laird.
Let's hear that.
But you know what we can't forget? We can vote these goofballs out of Congress. It's they're going to start campaigning pretty soon for 26, and they all, Colorado has half Republican, half Democrats in the House of Representatives. Most of us, especially in the rural counties, have Republican representatives, and let's just make it public. The league's going to put out an action alert going towards all of our conservative representatives who voted for this bill today, or in the early hours of the morning. We got to keep at it. We got to hound them. We have to tell our friends. We have to put it out there on social media, letters to the editor. It's a lot of work, but we can't let it go. We can't let it die off and just accept this as our fate.
And I would like to add something. This is Tony again.
Yeah.
And I think I'm safe in saying this because the League of Women Voters has a very strong position and has had for, 15, 20 years against Tabor. We will not be able to backfill cuts from Congress, from the federal government, with Tabor the way it is. And so we really need to get out there and work about changing Tabor as well.
That's a good
May
point.
I also say that a congressional recess starts tomorrow.
Okay. For how long, this one?
Just 1 week.
Okay, good. Okay.
But I think anyone in Congress should be having a town hall during every recess. That's
Shouldn't
just me.
I like when people host town halls without their representative.
Well, you could be sure there won't be any Republican town halls
No.
hit by Republican legislators.
But we can encourage our adjacent, our Democratic neighbors maybe to come into our counties and do the same thing.
Well, and hold them all accountable. All of them.
Right. Because they're just messing with our health, just in the Medicaid.
Our lives.
In general.
Our very lives.
Yeah.
Well, and something else I've noticed that's happening, and I'm sure you're receiving too, is fundraising requests. And if you have an opportunity to go to town halls, you just need to ask even our supportive representatives and ask them to say out loud, yes, I'm opposed to all of this stupid stuff and I support universal health care.
Mhm.
And when you ask them at a town hall, you not only ask them, but you educate the folks around you about, oh, you mean we can advocate for that?
Right.
That sort of thing. And when you go to a fundraiser too.
Mhm. Mhm. Yep, and a big rally's coming up on June 14th. You know, we'll see how that shifts public opinion on many issues.
I don't know about that rally.
Why? What do you mean?
June
Oh,
14th rally.
It's primarily put forth by Indivisible, but many other organizations are jumping in. It's being called No King's Day. It is Trump's birthday. It is Flag Day. It's also the birthday of our military, and it's
And
covering.
it's the day he's holding a military parade.
That's right. He's holding his own birthday party that's going to cost us like $100 million.
Yeah.
Right. So, and I think it might be the biggest one yet, biggest rally.
Party that wants to save us money and cut waste and
Yes,
and fraud
exactly.
government. Yeah.
Virginia.
I'm sorry, Virginia,
Go
may
ahead.
I say something first about
Go
No
ahead.
Kings?
Mhm.
Thank you. That march or protest is not officially sanctioned by LWVUS.
Mhm.
They ask all leagues to assess the protests in their area for nonpartisanship.
Mhm. Mhm. Yeah, before putting our logos out there or whatever. But
Yes,
I'm going as a private citizen for sure.
absolutely. Anyone can go as a private citizen.
Okay, Virginia.
Thanks. I just want to give a plug in the worst timing possible in the history of the world. Colorado Foundation for Universal Healthcare is having a statewide conference on June 14th.
Oh, wow.
We
Sorry.
arranged for our national speakers to show up before the protest materialized, but we're going ahead with it. We're just going to have a protest at the end of our
Oh,
thing.
there you go. Good.
So that people don't feel like they missed out. And something else that I just jumped on to is National Single Payer is having a National Day of Action on May 31st.
Oh, I forgot about that.
They're billing it as, a national single payer thing, but also hands off Medicaid. And that's on May 31st. And I just want to announce that I'm so proud that I created an event that we're going to do in Longmont at a place where they've been doing demonstrations for years. And so it's real easy to put together. But anyway, I got a dot on their map when there was nobody in the central country doing it. So the coasts both have dots, and now we've got a dot in Colorado.
Mhm.
Perfect.
Great.
Way to go. Virginia, can you send me information about that, and then I'll spread the word?
Sure, I'd be happy to.
That'd be great. Okay, any final comments from everyone?
Only that going to a universal healthcare event is an excellent form of dissent as well.
That's right.
Absolutely. Yeah. Thank you, Laird. Sorry about the slide deck mess up, but I think it didn't matter because what you told us had a lot of heft to it. So when we get the slides, we'll take a look at them and think more about it. And hopefully let's all on this call stay active and communicate with one another about what we're all doing. Thank you very much, Laird. I appreciate your efforts today. And let's keep doing the good work.
Yeah, thank
you.
all of you.
Go ahead, Laird.
No, I was just saying thank you.
Oh, all right, great. Everybody's saying thank you in the chat as well. And we'll get this.
Thank you.
We'll spread the recording to everyone as well. So go have a nice evening, have dinner if you haven't, and I'm gonna go find my granddaughter.
Okay.
And my husband.
Good night.
Thanks, Laird. Have
All
a good
right.
evening.
Thank
Good
you,
night.
everybody.
Thanks, Laird.
Welcome.
Thank you.
I always learn something the way you describe things.
Indeed.